Hello everyone, welcome to another episode of treatment options in surgical diseases. Today we are going to look at the treatment options in peripheral arterial occlusive disease. As we know, the basic formula is the treatment options will be gone under three headings: conservative, medical, and surgical. So here also we will be learning the treatment options under those three subheadings. So first one is conservative, where we are more counseling the patient and giving some precautions. So the first one is obviously the main predisposing factor is smoking. So we need to stop smoking and start walking. Stop smoking and keep walking. So exercise. That is one important factor we need to counsel to the patient. And controlling of the comorbidities. Control comorbidities means you have to maintain euglycemia, you have to keep the blood pressure in normal levels, etc. Okay, right. Then what else? You need to take care of foot. So foot care is very important, especially in case of diabetic peripheral arterial occlusive disease. We need to take the precautions to maintain the foot care. Okay, and obviously exercise is also a part of that. I have already written that. So these are the basic precautions that we need to counsel to the patient. Now coming to medical, it is nothing but drugs. So what are the important drugs we can use here? Means we can remember the drugs with the help of a mnemonic: PACs. So P for PG even analogs. The common drug is pentoxifylline. What is the mechanism of action? It will redefine the shape of RBC, and it will increase the flexibility of red blood cells, and the viscosity of the blood is reduced. So the circulation will be improved. That is the mechanism of action of pentoxifylline. A for the main patient comes with pain. So we are going with analgesics. Then also anticoagulants or antiplatelet drugs. Anticoagulants, like you can go for low dose aspirin as well as low dose aspirin, and also clopidogrel. Tablet clopidogrel 75 mg OD. Okay, same tablet aspirin 75 mg OD. C for silostazole. S for statins. What is the best statin? Rosva. Rosuvastatin greater than atorvastatin. Atorvastatin. Okay. So tablet silostazole 100 mg BD. One of the main side effects with this silostazole is headache. This is the most important side effect we need to remember. Also, silostazole is contraindicated in congestive heart failure. That is why whenever you get a patient of known cardiac disease where the patient is having congestive heart failure, and you need to keep the vasodilators, you should omit silostazole because it is contraindicated in this congestive heart failure. The main mechanism of action of silostazole is that it is a phosphodiesterase inhibitor. So it will cause muscle relaxation, and it will cause little bit vasodilatation. That is the mechanism of action. Right? Now, third option is surgical. So, what are the important surgical treatment options we have in peripheral arterial occlusive disease? Means, please understand. Mainly, this story of PVD will begin at the level of vessel. Also, because of the arterial occlusion only, the blood supply is getting decreased, and it is the next culprit that would be is nerve. Okay, and then if you are not able to treat at the level of artery or nerve, then you have to go for the limb. Okay, so you can remember the surgical treatment options like, so the first one is artery, then nerve, then limb. Okay, so regarding the artery again, so let me draw this here. So regarding the artery, let's say for example, you have thrombus or occlusion here. What are the different options you can address? That means you can go directly into the artery, and you can go for endovascular procedure where you are trying to remove the thrombus. That is called thrombectomy. So one option is endovascular. Okay. Then second one is, let's say for example you have a thrombus like this, a long segment thrombus where you are not able to remove this and all. There you can go for bypass like this. So second option is bypass. Rarely third one. This is not being done nowadays for all the arteries. Mainly for carotid artery it is being done. The procedure is called endarterectomy. Where, let's say for example, if this is the artery you are having, you know that we have three layers of the blood vessel. So we are cutting open the wall of the artery, and mainly you are removing this tunica intima and tunica media, and you are just keeping the tunica adventitia there. Okay, so that is called endarterectomy. This is not being done nowadays for all the procedures, I mean for all the cases. Now coming to now, let's say for example, the main action of sympathetic system is vasoconstriction. So you are going for, there are certain indications for this procedure. Just remember the name of the procedure. It is called sympathectomy. Sympathectomy. You are going and surgically removing the sympathetic ganglia, so this vasoconstriction effect will be reversed, so that little bit vasodilatation can happen. Also there are certain criteria when you should go for sympathectomy and what sympathectomy. Usually for upper limb PVD you will go for cervical sympathectomy. For lower limb PVD you will go for lumbar sympathectomy. Again in lumbar sympathectomy, at least you should preserve one lumbar sympathetic ganglion, because if you inadvertently remove all the lumbar sympathetic ganglia, it will result in erectile dysfunction. Okay, right. Next, coming to limb. So let's say, for example, the patient has come with gangrene. So you can't reverse the gangrene no matter what you do. Obviously, you have to go for amputation. So regarding the limb, the treatment option is nothing but your amputation. What amputation? Depending upon the extent of the gangrene, you will decide. Let's say, for example, the gangrene is confined to the foot. You can go for midfoot amputation, like you have named amputations. So you need to remember the names of the amputation. So one is Lisfranc amputation, Chopart amputation. Chopart is at the level of intertarsal joints, whereas Lisfranc is at the level of tarso-metatarsal joint. Then you have got Sims amputation, then BKA below knee amputation, AKA above knee amputation. There is something called hemipelvectomy, or in upper limb you will be having four-quarter amputation. So these are the different amputation options you have. Also, at the level of foot, let's say for example, the patient has come to you with only one toe gangrene, then you will go for something called ray amputation, where you are removing only that single toe. So let's say for example, the patient has got like this. This is the foot, and the patient presented with the gangrene of only great toe. Then obviously we'll go for only removal of that particular gangrenous toe. So let's say for example, patient has come to you with this gangrene. So you will go only with the amputation of that particular involved toe till the, you will remove a part of the amputation, you will remove the part of the till the uh, metatarsophalangeal joint till you go there, and you will remove only that particular toe. That is called ray amputation. This is otherwise called disarticulation. More or less you will be going there. So these are the different named options, named amputations you will be having here. Again there are subtypes of BKA, like posterior Burgess method, or you will go for Gilton method. Depending upon the scenario, you will go for the different treatment options. So this is the list of treatment options for peripheral arterial occlusive disease.